Yes, can it help? Sure. May help.
Afternoon, how can I help you?
I'm here to pick up my prescription.
Okay, what's your name?
I'm Elizabeth Donalyn.
Okay, I'm Nemenzo. Nice to meet you.
Nice to meet you.
I'm your pharmacist. And are you picking for yourself then or for someone else's?
For myself.
Okay. Then, since it's a new prescription, I would like to spend a couple minutes talking to you over with some important matters to make sure you're taking your medications safely. Do you have a couple of minutes?
Yeah. Sure.
Great. Well, okay, before we get started, we have to verify information to make sure you're up to date. So, Mom Elizabeth, can I call you Elizabeth?
Yes, sure.
Okay. Elizabeth, you're 77 years old, correct?
Correct.
So, are you still living in Coquin, Rosario Street?
Yes.
Okay, perfect. For your medication, you have here paracetamol, 500 milligrams, spironolactone, 25 milligrams, verapamil, 80 milligrams, ramipril, 5 milligrams, furosemide, 40 milligrams. So, you can take a look. Metformin, 500 milligrams, glibenclamide, 5 milligrams, and digoxin, 62.5 micrograms. Correct?
Yes, correct.
Great. And then what other medications or over-the-counter herbals are you taking?
None.
And then your allergies. There's no known drug allergy or any other known allergies you have?
I think none.
Okay, perfect. So let's start. What did your doctor tell you about your medication?
He told me that these medications are helpful in my condition.
Oh, that's correct. So you have been prescribed with spironolactone, verapamil, ramipril, furosemide, and digoxin for your heart failure therapy. Although these drugs seem to have the same effect to your body, but please remember that they work on different mechanisms, and also they may cause interactions when taken all together. So you can take these drugs all together at one time. So do you get it?
Yeah.
Like for example, you'll take this, but this you will take this like 4 hours after. So
how will I know when to take these drugs?
well, don't worry. I will give you your dosing regimen or your schedule and when you will take these drugs.
Thank you.
So next is you are taking glibenclamide and metformin for your diabetes therapy. So please take note that when you take metformin, you have to avoid eating citrus fruits and juices like lemons, oranges, and please remember that when you take this drug, there would be a vitamin B12 depletion in your body. So I suggest that you will eat vitamin B12 rich foods.
What foods?
Well, example is fish, eggs, and beef. And when taking glibenclamide, no alcohol, please. Okay?
Sure.
Great. Do you feel pain in your chest always?
Not always. Sometimes though.
Oh. Well, that's why your doctor prescribed aspirin, which is for the pain management, and isosorbide mononitrate for your angina therapy. While taking these two, you have to remember that you have to avoid alcohol because if you will drink alcohol, you might feel dizzy and your blood pressure might elevate. Okay? Questions so far? Are you having difficulty in your sleeping or do you feel anxious in any way?
Sometimes I feel anxious because I think about the worst things, that might happen.
Oh, go on.
I'm sorry.
It's okay.
Yes, I have insomnia.
Okay, I know where you're coming from. And I know that this might be a little bit hard for you, going to the doctor for checkups, going to the pharmacy, and taking a lot of medicines. And but let me assure you that this will make you feel better, or will make you feel better, and nothing else. Okay? And there's nothing to be anxious about.
Sure.
All you have to do, Mom Elizabeth, is that you follow all of your doctor's instructions and mine, of course. And most of all is that you pray. I think prayer is the best medicine. Do you think so?
You're right.
Yes. So, about your problem in sleeping, your doctor has prescribed you temazepam and oxazepam. It is to manage your anxiety and to help you get better sleep at night. But please remember, you have to follow the prescribed dose and do not exceed the recommended dose to avoid drug dependence. Do you get it?
Yes, sir.
Okay, remember, you have to take only one capsule of this temazepam at bedtime. Okay? Okay, perfect. So, Miss Elizabeth, let me remind you that each of these medicines come to have side effect or two or more, and you might experience some. So when you feel such, please, you don't have to panic, and it is normal because of these medicines. And please don't hesitate to call me, your doctor, if you have questions. Okay?
I will.
So back to your diagnosis here. You have complaints of some side effects like headache,
Yes.
blurring of vision. Have you experienced that?
Yeah.
Dry mouth and nausea. Like you wanna vomit or
Yeah.
yes. Oh.
Yes.
Well, I think that's pretty normal because you're taking these medicines, and I guess headache is the most prevalent. That's why your doctor has prescribed you paracetamol as an analgesic or to take away the pain. And as directed by your doctor, you only have to take it when needed, or meaning only when you feel such, like you feel headache after you drink this medicine, you have to take the medicine.
Okay.
Paracetamol. Okay?
I
You
will.
got it?
Get it.
So, other recommendations for you is that you should watch your diet. Like when you take your medicines, you have to watch your potassium intake. Like, foods rich in potassium.
Banana.
Banana, yes, banana. And since you're taking furosemide, it can cause depletion of potassium. That's why you have to eat banana. But you are also taking spironolactone, which also that's why you have to keep your potassium intake at minimum, because it will develop hyperkalemia or high potassium level. So when you eat, like for example, you eat bananas, two bananas, you have to make it only one. Okay, get it?
I will.
You have to take your potassium intake at minimum. And then, also, since you're taking ramipril or ACE inhibitor, you also have to watch your salt intake. And most importantly, you avoid drinking alcohol. And please remember that because alcohol would cause many drug and alcohol interactions between your medicines. Okay?
Okay.
So here's your dosage regimen. Here. All you have to do is to follow this signa or the direction of the doctor, which that states here that how many times you will take the drug. Like the spironolactone, you have to take it 4 times a day, meaning 4 times a day every 6 hours.
6 hours.
Yes. And the verapamil, 3 times a day, meaning every 8 hours.
Yeah,
The ramipril, one only one time, and the metformin, the glibenclamide, and oxazepam. The furosemide, 2 tablets in the morning. Okay. The temazepam, you only have to take it at night when you're having difficulty in sleeping. One capsule only. Okay. And the aspirin, okay, survive. But you have to watch. I have written here the drugs that you will take together and the drugs that you don't drink that time. Okay. Very good. So
This is mine now.
yes, it's yours. You have to take it. It's very important.
I will.
Since we lack ample of time to discuss everything, I will give you these leaflets or reading materials for you to read to have some information about your medicine. Okay?
Are these for free?
Of course, it's for you. Else you would like to ask or suggest?
I will clarify about what you said about the banana. I will
Yes.
just limit the what's that?
You have to. You don't have to eat too much banana. Like, you have to limit your potassium intake. You don't eat too much banana. Okay.
Oh, okay. Thank you.
Yes. So anything else, Elizabeth?
That's enough. That's thank you.
Okay. I hope I have helped you and in any way. And please, if you have any questions, please feel free to contact me and of course your doctor. Well, I have written already there my contact number if you have important things to ask. So
Thank you so much. You've been a great help. I will call you if it's necessary.
yes, okay. Thank you for your time.
Thank you. Have a good day.
Thank